Hi there, my name is Jackie Watson and I'm a respiratory care student at the Baptist College of Health Sciences. Today I'm going to be talking about the use and benefits of the vest, which is high frequency chest wall oscillations, which is a form of airway clearance therapies. There are three parts to high frequency chest wall oscillation devices. You have your air pulse generator, which creates the vibrations used for the airway clearance, your hosing, and your non-stretching inflatable vest, which is what is applied to your patient. There are different types of patients that will benefit to the use of high-frequency chest wall oscillations. These patients may have acute conditions causing thick tenacious accretions or an inability to produce an effective cough. Or they may be patients with chronic conditions causing thick tenacious secretions that can't be properly expectorated through a cough. These conditions can include cystic fibrosis, bronchiectasis, dyskinetic ciliary syndrome, and COPD with retained secretions. So while high-frequency chest wall oscillation devices can be very beneficial, there are times when you should not use this device. Conditions that patients may have that would be contraindicated would be injuries to the head or neck that have not been stabilized, hemoptysis or coughing of blood, being hemodynamically unstable, the presence of an empyema or pus in the lungs, or fractured ribs. Check the patient's chart before entering their room to make sure that the patient does not have any of these contraindications. Once you have checked the chart for no contraindications, ask a caregiver, the nurse, or the patient when their last meal was. If the meal was less than an hour and a half prior, wait until it's been an hour and a half to prevent nausea or vomiting caused by the vibrations of the device. Now, when you've determined that it's the proper time and appropriate to apply this device, when you enter the room, make sure you use AIDed. Acknowledge the patient, introduce yourself, give the duration of the treatment, explain the treatment, and then later thank the patient for allowing you to apply the therapy. So when you're finally ready to apply the therapy to your patient, make sure to recheck the physician's orders or know your facility's protocol for using this device. These instructions will include the settings that you'll apply to your patient, such as the hertz, which is the frequency of the vibrations applied to your patient, ranging from 5 to 25, and the pressure, which is how much the vest is going to inflate around your patient and determine the tightness of the vest around your patient. Before you can attach the device to your patient, you're going to make sure that you assess your patient. So you're going to listen to your patient for breath sounds. Because of copious secretions, which is an indication for use of this device, you'll likely hear something like rhonchi or crackles, or maybe even diminished if the secretions are so tenacious. You'll also listen or feel for the pulse to see if it's too rapid. Then you'll also look for the breathing pattern to see if it's adventitious. Once you have done your assessment, it's time to apply the vest to your patient. My patient here, Amanda, already has the vest applied without the snaps. The vest is appropriate for Amanda, a size small. When we clip it onto her, it's not too loose and it's not too tight. And if it is a little bit too loose, we can pull on the straps to tighten it as needed. If it's too tight, the patient won't be comfortable and won't want to continue the therapy. If it's too loose, the patient won't receive the benefit of the oscillations. It's also important to note that the vest has Velcro on the shoulders for easy application. Another modality of the vest is a wrap that goes around the torso or the thorax of your patient without the shoulder straps, which may be more appropriate for patients who are immobile. Once your patient is secured in their vest, you're going to attach the hosing. Some vest systems have a clip that secures the hose to the ports. This just has your tubes that attach to your ports, one on each side. So you want to make sure they're good and snug on there so that when you begin your oscillations, they don't go flying off. All right. Once your patient is attached, you can turn on the machine. Don't forget to use the protocol or the orders from your physician. If neither are provided and your patient has a chronic condition like cystic fibrosis and often uses the device, ask what they use, what their preferences are, and what works for them. So for Amanda, we have to make sure we turn it on. And we're going to start her. It begins at 5, but the machine is automatically going to 12. And then is it already inflated? Mm-hmm. So the vest is already inflated, so you know that the hoses are properly applied. She's at a pressure of 4. Are you comfortable or is it too tight? So your patient is comfortable, and that's great. So once you have determined your settings, you're going to press the on button to begin your treatment. And also, the duration of treatment is typically 30 minutes for between 4 and 6 times per day, depending on the orders. So then we just press on and the oscillations begin. If your patient feels uncomfortable for either the frequency or the pressure, it is easily adjusted. There are times when you may need to stop therapy at once. If the patient begins to show signs of hypoxemia during your assessment, during the therapy, if they begin to develop new bronchospasms or wheezing, if they begin to vomit, have new pain, or become acutely hypotensive. If any of these occur, stop therapy immediately, apply oxygen if needed, and notify the nurse and the physician. Once you have completed the therapy, ask your patient to cough. So Amanda, could you please cough for me? Evaluate the patient's cough to see if it was effective or productive. If it was productive, analyze the sputum. Was it viscous? Was there a large amount? Was there a color, or did it have an odor? Once you have evaluated the sputum, complete the assessment as you did before beginning the treatment. Check for pulse, respiratory rate, and breathing pattern, as well as mentioned before, the cough and sputum production. Once you have completed your therapy, make sure to disinfect all the pieces of your device, especially if you'll be using the same appliance in other rooms. And don't forget to document your use and assessment of your patient. High frequency chest wall oscillation devices have proven to have a variety of benefits. Cystic fibrosis patients have shown an improvement in their secretion movement as compared to other modalities of airway clearance therapy. Other populations also showed improvement as seen through their perception or how they felt that they were improving, through their actual outcomes or what the clinicians were measuring, and their compliance of the treatment. Because of these benefits, it's important for the therapist to be comfortable and knowledgeable of the device and how to properly use it. And I hope this video helped you to do just that. Thank you.